Black Friday savings are here at the Home Depot, which means it's time to add new cordless power to your collection. Right now, when you buy a select battery kit from one of our top brands like Ryobi or Milwaukee, you'll get a select tool from that same brand for free. Click into one of our best deals of the season and stock up on tools for all your upcoming projects. Get Black Friday savings happening now at the Home Depot. Limit 1 per transaction. Exclusions apply. Full eligible tool list in-store and online.
At Sierra, discover joyous deals on great gifts for everyone on your list. Like cozy slippers, ski gear, fishing poles, bikes, large kayaks, even larger canoes. Whew, which might lead to another discovery. Wrapping gifts is the only sport you need to stay fit this season. 'Tis the season to discover great gifts at unexpectedly low prices. Sierra, let's get moving.
Well, hello there. I'm Nurse Mo, and welcome to Mo's Monday Minute, a shorty episode of the Straight A Nursing podcast where I share a quick tip you can start using to improve your practice or habits right away. For more in-depth topics, check out the episodes that I release on Thursdays. In this shorty episode, we're talking about a term you might hear thrown around in the clinical setting, and that is the 50/50 club. So what does this mean? So when you hear someone say, oh, Bob's in the 50/50 club, this is a way to describe patients with advanced COPD who often live with chronic gas exchange abnormalities. So in the case of your friend Bob, the ABG may show a PaO2 around 50 millimeters of mercury and a PaCO2 around 50 millimeters of mercury. This simply means that if Bob is in this special club, that we're not going to get crazy excited if his numbers come back on his ABG in that range, because that's where he is all the time. This actually probably means our good friend Bob is actually doing okay. So why does this happen? In COPD, chronic airway obstruction makes it really hard for the patient to ventilate effectively. And over time, patients retain CO2, leading to that elevated PaCO2 level. And they don't exchange oxygen optimally, so PaO2 runs low. But here's where it gets really important. Is it chronic or is it acute? So in chronic hypercapnia, like our friend Bob, the body has had time to compensate. The kidneys retain bicarbonate to help balance the pH. So even though the CO2 is high, the pH may look normal or very, very, very near normal. These patients can live at this baseline for years and years and years. And the body can also compensate for that low PaO2 by producing more red blood cells. So that's why Bob is perfectly fine in his special 50/50 club, because it's chronic and his body has had time to compensate. But what if it's acute? So looking at CO2, if CO2 rises quickly and the body hasn't had time to compensate, that pH is going to be low, right? Because compensation has not yet occurred. This is that classic display of respiratory acidosis, and this can be dangerous and does require immediate intervention. And of course, acute hypoxia as well. Definitely dangerous. The patient hasn't had time to make more red blood cells or anything that could compensate for this. So if your patient is in the 50/50s on their ABG, you need to find out, are they in the club? Basically, are they chronic? Are they okay at this level? And of course, also looking at their whole clinical picture, or are they acute? Is this an acute change from their baseline? So when you see a patient with their ABG in that range, don't panic right away if they are a COPD patient. Find out what their baseline is and assess your patient. Take a look at Bob. Is he getting drowsy? Is he getting restless and confused and agitated? Those could be signs that CO2 is elevating and or that PaO2 oxygen levels are decreasing. So some key takeaways are to always compare the ABG on your COPD patients to their baseline if they have one, and if they've been a patient of your hospital, your facility for a while, chances are you have a baseline somewhere. Another takeaway is don't necessarily chase a perfect SpO2 of that, high 90s to 100%. For many COPD patients, especially ones like our friend Bob, who is in this very elite club, then a lower SpO2 is often acceptable and optimal for this patient. So make sure you're discussing this with your physician partner and getting an order for maybe like an SpO2 of 88% or whatever is acceptable and baseline for your good friend Bob. And then you want to also monitor your patient just very closely for any changes. Bob's in the hospital for a reason, right? So maybe he's not perfectly healthy right now, so things could change quickly. And you're watching for signs of an acute exacerbation. So just because Bob's in this special club where he is always kind of in that 50s range for the carbon dioxide and the oxygen does not mean that he cannot have an acute exacerbation on top of that. And we'll hear that, you'll hear that called acute on chronic. So it's an acute exacerbation on top of a chronic condition. So with Bob, I'm still watching very closely for signs of hypercapnia, which is going to be that somnolence, even to the point where Bob's not arousable. I'm watching, hopefully it doesn't get that far, but yes, it can happen. I'm looking for confusion, restlessness, anxiety. That happens with that low oxygen level. A patient having a headache, things like that can all occur when the patient's CO2 and O2 are out of whack. So I hope that helps you understand what this term means and apply it to how you are looking at your patients, making sure you're looking at their long-standing situation, their baseline ABG, and all of that when you are treating them in the clinical setting. See you again soon. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
Monster Energy. Everybody knows White Monster Zero Ultra. That's the OG. It kicked off this whole zero sugar energy drink thing. But Ultra is a whole lineup now. You've got Strawberry Dreams, Blue Hawaiian, Sunrise, and Vice Guava. And they all bring the Monster Energy punch. So if you've been living in the white can, branch out. Ultra's got a flavor for every vibe. And every single one is zero sugar. Tap the banner to learn more.